Now to For Your Health. If you're among the 100 million people who have back pain, how do you know whether or not you need surgery?
And how do you know if the surgery you're planning to have will actually work for you? Dr. Bruce is just back from his own back surgery. What is it? 2 weeks ago tomorrow you had it,
2
right?
weeks ago tomorrow. And
How
a
you
lot
doing?
of lessons to be learned that I had to learn and that I'm going to help you
But
learn.
how are you doing?
I'm doing better. I'm doing better. It takes 4 to 6 weeks to recover fully until you know whether it worked. Whether or not it worked is one of the questions. So let me explain to you how important this is. The fact is many people with back surgery do not need surgery, and it doesn't always cure the problem. The way I decided, what I considered with my doctor, how I chose, will help you know how to make your decision. This was the day I worried about for years, the day I would finally have back surgery. As I walked into Spaulding Surgical Center at 5:30 a.m., I thought about the whole process my doctor, Ted Goldstein, and I went through before deciding on surgery.
The vast majority don't need surgery.
The first step should be finding out if you're among the very small minority who need quick emergent surgery.
Or the people that have a neurologic deficit, a drop foot, certainly loss of bowel or bladder function.
If you don't have those symptoms or a weakness or paralysis along with your pain, you should try the same conservative treatments I tried. Anti-inflammatory medicines, ice, physical therapy, acupuncture, chiropractic, medicines, and finally steroid injections, epidurals, right into the spine. When all that failed and my pain got worse, I got my second MRI. If you take a close look right here, you see a ligament and some bony prominences actually pressing on the nerves. Despite how severe the picture looked, we knew an MRI should not be the sole reason for surgery.
You can't operate on an MRI or on pictures. You have to take the whole individual's lifestyle, the compromises he's made, and make a decision based on that.
We've done all the conservative things for you, including epidurals, medicines, etc. You've failed all of those, so now we think surgery is appropriate for you.
As I was wheeled into the OR, I was nervous, just like you might be. Once I was unconscious, Goldstein and Roten went to work.
It's called a laminotomy or a laminectomy. It basically means you remove some bone and some thick ligament, and you make room for the nerves so that they can breathe, if you will. And this tight passage becomes larger. The entire operation took just an hour. I woke up slowly. Although I was uncomfortable, I went home that same day. Okay, that looks good.
When I saw Goldstein for my follow-up visit, he reminded me what I most want you to know.
The surgery was the right choice for you, but the message wouldn't be that it's the right choice for everybody. It depends on each individual and their circumstances and their needs. Let me explain. I do feel a lot better than before surgery, but it takes 4 to 6 weeks to get the full result. Now, when it's done on the wrong person, it may fail. Studies show surgery may cure pain only 60 to 80% of the time. So I'm going to repeat the lessons I want you to hear. If you have numbness, weakness, paralysis with back pain, you may need quick surgery. If not, see an expert. Discuss all the conservative treatments, try them, and take time. That way, you can get the most benefit with the least risk. So more tips on my back pain and what you can do, go to our website, NBCLA.com, the keyword, back pain. I'm happy to be
We
back.
haven't seen you in 2 weeks, so I may have jumped the gun asking you, but we really wanted to know how you were doing.
I know, and I feel a lot better than before surgery.
And you're
Ask
moving
me
well.
again in a month.
Okay, we will.
We will. Thanks, Dr. Bruce.